Hi everyone, this is Nilanjana coming to you with your video on gout. I have been a doctor for the last 25 years and a GP for the last 20 years, and gout was requested by a close friend. Gout is a kind of arthritis or arthropathy. Patients with gout usually come to us with a swollen, tender and very red big toe. Very rarely it can be the ankle or the knee. It is usually the big toe that is the presenting joint. Gout is due to high levels of uric acid in the blood. And why we're getting high levels of uric acid? It is because the body is unable to deal with the high level of uric acid, and the uric acid then settles in the joint as crystals. This leads to inflammation, swelling and redness of the joint, thereby giving rise to gout. So when I see a patient with a red, swollen, inflamed big toe or knee, then I order blood tests and I will also order an X-ray. The blood test will check, among other things, the level of uric acid in the blood, and the X-ray will look at the bones to see if the swelling is related to bones. Once the reports are back, I will have a review appointment with the patient and discuss the results with the patient. If the uric acid levels are above normal range, then the patient is diagnosed with gout. For the pain and the inflammation, we give normal ibuprofen with a stomach protector like omeprazole for pain control. And we also give the patient some information on what foods to avoid and what drinks to avoid. Once the patient has taken the medication and has had relief from the pain and the swelling, the episode will have subsided. However, if the patient gets more than 3 episodes a year, they then need to take preventative medication. Now, preventative medication means that the patient needs to take 1 tablet a day for the rest of their lives to prevent further episodes of gout. This only happens, as I've already said, in patients who are getting 3 or more episodes of gout in 1 year. Generally speaking, patients are advised to keep a supply of non-steroidal anti-inflammatory drugs like ibuprofen or naproxen with a stomach protector like omeprazole in supply at home to preempt any serious attacks of gout. Gout also presents a big cardiovascular risk. So, say for example, in a patient with diabetes, if they develop gout, we will have to discuss the increased cardiovascular risk with the patient. We will have to make sure that the patient has good control of their diabetes, is controlling their blood pressure and their body weight, and also that they are able to maintain their diet according to what is needed to avoid further attacks of gout. Outside of the cardiovascular risk, attacks of gout are extremely painful, and patients will often be completely bedridden by the pain that they're getting in the ankle or in the big toe. Outside of this, gout does not affect many of the other joints, but the joints it does attack, it leaves very painful, very sore and very inflamed. If you have any further questions on gout, I'd be happy to try and answer your queries. The best thing to do when you have an attack of gout is to start taking ibuprofen regularly with food, with omeprazole cover for stomach, and also to try and apply ice packs to try and cool down the inflammation in the area. There is a lot of information in the internet, especially on the NHS website, about gout and what foods and drinks to avoid. This is something I would direct every patient to, because this is very, very useful in avoiding further attacks of gout. In conclusion, I would like to say that if you have any further queries, questions, suggestions, or concerns about gout, please feel free to post all your queries in the comment box below. I hope you have liked this video. Thank you for listening and good evening.